Hey, are you looking for help for a possible neck arthritis situation? If you find that you've got a stiff, achy neck and you have trouble turning it's been bothering you for a while now, then this might be the right video to help you out. I'm going to cover the top 5 signs of neck osteoarthritis, commonly known as arthritis. And it's a little bit different from rheumatoid arthritis and psoriatic arthritis. There's many variations of arthritis, but the most common one by far is osteoarthritis. My name is Dr. David Midoff. I'm a physical therapist and owner of Paso Manual Physical Therapy, and I help people all the time with neck arthritis problems. So let's get into the top 5 signs that you've got neck arthritis. Sign number 1, consistent neck stiffness. And the way this looks and feels is if you turn to one side and it just doesn't go as far as the other side, the one side turns well and the other one not so good, or both have limited, that happens occasionally too. You find that over the past year or several years, your neck stiffness has increased and you can't turn as far. And you notice it most when you go drive and you check your blind spots to change lanes or turn. You just can't go as far and you find that you're twisting through your back more. If you've had consistent stiffness like this, it may not hurt. It may not hurt at all to turn, but it just may feel like you can't go as far. If this has been happening for more than a few months, 3 months, and it's been going on for many months, maybe even years, there's a high likelihood that you've got a neck arthritis problem. Sign number 2, shoulder pain. Commonly, we see people that have neck arthritis that also develop shoulder problems. Occasionally they have a real bad one like a rotator cuff tear, an impingement problem, a nerve issue that comes off their neck and begins to affect the shoulder. But they'll complain of shoulder pain, especially when they lie on that side or use the arm. And it's not always to the side that they're limited to. In other words, if you have trouble turning to the right, you would think that it's always going to be the right shoulder, and it does happen more often than not that way, but it can affect the other shoulder, especially if it's a nerve-related issue, because if the nerves are affected in the neck, whether it's a right-sided or left-sided neck problem, it can affect the nerves on the opposite side as well. Sign number 3, trouble sleeping at night. If you've been trying different pillows, different mattresses, different sleeping positions, lay on this side, lay on that side, try your back, face down didn't work, and you're just having restless nights, losing hours and hours of sleep weekly because of this stiff neck problem, this arthritis problem, there's a very high chance that you've got arthritis developing in your neck joints. And I can tell you right now, it's most often, 9 out of 10 times, not a pillow problem, not a mattress problem. Getting a nicer pillow or mattress may take the edge off and allow you to get a little extra sleep, but it's not going to cure the neck arthritis problem for the long term. Sign number 4, pain medication stopped working. You may have been able to take the edge off, taking a Tylenol or ibuprofen or some similar over-the-counter medication, but you found that it doesn't do anything anymore. You've been taking them regularly and as needed, and it doesn't do anything for you. You get to the end of the day or you get through the end of the night, and the neck still feels achy, stiff, and painful, and you have trouble turning, and sleeping hasn't gotten any better, and you're thinking of going to the doctor's office to get some prescription strength medication. In some cases, there might be people that are taking prescription strength medication already for a neck problem, or worse yet, have had injections into their spine for the neck problem, pain medication injected into the spine, and it didn't make a big difference at all. It just maybe took the edge off a little bit, but they're still having trouble turning their head and sleeping better at night and feeling decent throughout the rest of the day. If that's you, pain medications have not really been working for you anymore, there's a very high likelihood that you've got a neck arthritis problem. And sign number 5, stretching hasn't helped. You've thought, well, I can't turn this way, let me stretch it into that direction and see if it'll move better, and it just hurts and it's uncomfortable to move in that direction. Maybe you feel like some pinching or burning sensations in the neck area. Maybe your shoulders are getting affected with the stretches. It's more uncomfortable than helpful to do the stretching. Then there's a very high chance that this is a neck arthritis problem, and stretches just aren't going to get you the relief that you're looking for. So you're probably thinking now, well, what do I do if I've got neck arthritis? I've got 3, 4, or 5 of these signs that you just talked about. What do I do next? Here in the clinic at El Paso Manual Physical Therapy, we help people with neck arthritis all the time. There can be several different factors that contribute to the neck arthritis problem, and so it's hard to tell you over a video like this exactly what to do at home and exactly what's going on in your neck. Of course, we need to do a proper assessment. We need to feel the joints. We need to look at the nerves. We need to look at your muscle strength, look at ligaments. If you've done any sort of MRIs or x-rays, you need to look at that and see how affected your joints are to get an idea of what's the possibility of this progressing 100%. And you might be thinking, I'm old, I'm over 50, I'm in my 60s or beyond. This is part of getting older. I get arthritis. I've got arthritis in other areas, so now this is getting affected. And even if you are a little up there in age, we have cases here all the time that improve despite bad looking MRIs or x-rays. They get to the point where they can sleep at night. They're not having to rely on pain medications. Their motion comes back. Driving becomes easy. They can turn and check their blind spot without any problems. And it's a matter of getting to the root of the problem, which in most cases is a multifaceted situation. There's many things to look at and properly address so that that individual with a severe neck arthritis problem can find long-term lasting relief without having to rely on pain medications or resort to pain injections or having to have a surgery for this neck problem. If you're looking for help right now, I invite you to download one of our free neck pain guides. If you look at the button nearby or scroll down the page, you'll see a picture of a book that covers 10 ways to relieve neck and shoulder pain. You can type in your details once you click on the book cover, and a form will pop up. Leave us your phone number, name, and email, and we'll send you instantly a PDF in your email of that book that you can begin to read on your computer or phone right now. I hope that we can be a part of your success story in relieving your neck arthritis situation and preventing surgery, ending having to get injections, and not having to rely on pain medications for the long term so that you can enjoy life to the fullest and not have to worry or think twice about your neck problem. Have the best day. Bye-bye.